don't wait until your child turns 5 or 6 to get COVID vaccine. Get it as soon as you can. Once they hit that next age milestone, either 5 or 6, they would then fall into the recommendations for that age group.
What are the differences between the Moderna and Pfizer vaccines?
Moderna is currently a 2-dose series for kids 6 months through age 6. Pfizer is a 3-dose series for kids 6 months to 5 years.
So Moderna is 2 doses of the vaccine spread approximately 4 weeks apart. For the Pfizer vaccine, it's 3 doses. The first 2 are 3 weeks apart, and then the gap between the second and the third vaccine is 8 weeks.
What are the common side effects of these vaccines in this age group?
Soreness at the site of the injection and maybe a little bit of redness and then maybe a little bit of fever.
How soon could the vaccines be administered here in Columbus through Nationwide Children's Hospital?
The vaccines are starting to roll into the hospital and in our clinics today. We anticipate starting to vaccinate tomorrow morning. We have clinics open and scheduling is available to the public throughout this week, and we'll continue as driven by demand for vaccines.
If a child in this age group had COVID-19 recently, do they need to wait before getting the vaccine? And if so, how long?
Studies haven't quite defined what the best timing is. The other problem is that as we all know, the virus keeps changing. So, if you've had COVID recently, several weeks to months later, there could be new variants that come along. So, in general, I typically have been recommending waiting about 3 months.
If a child had a mild COVID-19 infection and recovered, do they still need to get vaccinated?
When you have natural COVID infection, your antibodies that you're producing are going to be against that specific variant of the virus that you were infected with, as opposed to the vaccine, which provides a little bit of a broader spectrum of immune response. So bottom line is, yes, I would recommend that you get it.
What if a child is due for other immunizations? Will a COVID-19 vaccine interfere?
Children should be able to get the COVID-19 vaccine alongside other childhood vaccines. For years, we've given lots of vaccines concurrent with one another, and we've seen no issues with that. And we've been doing that now for several months with the COVID-19 vaccine in older patients and not seen any issues in terms of efficacy or safety. And so we believe that you can get that vaccine alongside your other pediatric vaccines.